Hello, guys. My name is Josh. I am a final year medical student at the University of Southampton. And this is part 2 of my Introduction to Global Health Ophthalmology webinar, which I've done with the kind help of the Medics.Academy. I did the Medics.Academy virtual elective program in May, and this has culminated in doing this series of webinars. So I did part 1. Part 1 was basically an introduction to the whole concept of global health ophthalmology, why it's so important, why ophthalmology and global health are linked. And in part 2, we shall discuss this. We shall discuss 3 avoidable, preventable causes of global blindness. We'll look into these 3 causes in a bit more detail. For those of you that live in the UK or maybe other high-income countries, these are conditions that you may not have come across before, but they are important to kind of know about in a general sense, not for medical school exams, but more just for general knowledge. I think they're really massive diseases. And yeah, I think we'll just crack on and get straight into it. So an introduction to me, I am as I said, final year medical student, University of Southampton. I have an interest in ophthalmology, medical education, and research. And I guess my interest in ophthalmology and medical education is why I'm doing this series, and why this topic, I'm interested in it, and why this topic of global health ophthalmology, I should say, I'm interested in it. It's kind of interesting, I think, from a general knowledge perspective, because it's not necessarily on medical school curriculums, but an important topic to know about in a general sense, get an understanding of or feel for global health, and just good knowledge really about socioeconomic development, and about global health, really. So, and I put the asterisk there as well for those who haven't seen from the first video. Although this stuff isn't in medical school curriculum, if any of there are students watching who are interested in doing a Duke Elder exam, this stuff is important for that exam. If you're not sure what a Duke Elder exam is, I gave a very brief introduction in part 1, but do look into it if you're interested in ophthalmology and you're a medical student in the UK. Cool, so we'll just get on with the presentation now. So in part 1, I introduced this towards the end, avoidable blindness, preventable disease, and reversible disease. In this part 2, we're going to be looking at preventable diseases. We're going to be looking at the diseases that cause corneal opacity, and we're also going to be looking at Jacoba as well. So all these diseases, they're not necessarily common in places like the UK, but they are common to other countries worldwide, and we will go through them in a bit more detail. So we'll start with onchocerciasis, or river blindness. What is onchocerciasis? It's a parasitic disease. The causative agent is Onchocerca volvulus, which is a parasite, and the vector is a female black fly, which it spreads the parasite by biting other humans. The parasite then comes into the tissue or bloodstream, but certainly once the parasite's inside the body, it lays multiple offsprings, and they travel in the bloodstream to where they're going to cause lots of issues. But we're going to be focusing on the eyes today. So epidemiology, 21 million people are infected worldwide, but 100 million people are classed as at risk of the disease. It's relatively common in 30 to 40 countries, so quite a lot of countries do have this problem. And it's those who live or work near bodies of water who are most at risk, which is where the black fly breeds. In this image, it's just showing areas where onchocerciasis is still endemic. The more red the country, the higher the prevalence of onchocerciasis. You can see that it's affecting sub-Saharan Africa, in particular Nigeria, also affecting some of the northern countries in South America. It's affecting Mexico as well. It's affecting Yemen. So quite widespread, and of course not something that we're seeing in the UK, however. In this image, we'll look at the image on the left first. So that's a zoomed in image of a female black fly. Coming out of its antenna on the left, that is actually Onchocerca volvulus itself. That's the parasite coming out. Quite gruesome, quite interesting, depending on how you look at it. But so that's it there. I've put the ruler here because this parasite kind of grows to be 50 to 80 centimeters long. So mind blowing to think about it. being in a human body, but that is the anatomy of it. And I put the calendar because this parasite can, once infected in a human, it can stay there for up to 14 years, a really chronic infection. And you can imagine that when you've got this thing inside you for 14 years, the damage it can cause if it gets to your eye. In these images, on the left image, that's showing the actual parasite itself again, and it's in the anterior chamber of someone's eye. It's swimming around, it's live, it's mobile. It would be mobile if the image was playing, and it's just in front of the pupil. And you can imagine having something like that in your eye is going to cause problems, and we'll go on to the pathology in a bit. On the right, there's this pathognomic appearance that you get, mainly on the shins, I believe, of this raised lump, and it's called an oncocerca. Oncocerca mater is another place where the parasite can go, and it will basically, I believe that the multiple larvae that have originally come from the first infection will culminate in areas like this in the Oncocerca mater. So so just two signs to know about. So what's the pathology of onchocerciasis? So basically, as we just saw in the previous image, the parasite comes into the eye, and actually preferentially will come to the eye. Like with the Oncocerca mater, it's mainly associated with coming into the eye. Once it comes into the eye, the parasite likes to burrow into the cornea. And once it does that, it just causes, as you can imagine, it damages the cornea, and it causes lots of scarring. As more and more parasitic larvae come into the cornea and burrow in, it eventually causes corneal opacity. The cornea is damaged, it loses its transparency, and you may end up with an eye like this. They will not be able to see like this, and very serious once the blindness gets to this level of corneal opacity. I'll talk about why corneal opacity blindness is so severe, but as you can imagine, really affecting vision there. So how do we prevent and treat it? Why is it easily preventable? Well, we can prevent with insecticides, and we can prevent and treat with ivermectin. Insecticides, of course, are targeting the female black fly vector, and prevention and treatment is with this antiparasitic drug called ivermectin. And as I understand, it's completely revolutionized the treatment of onchocerciasis in many populations all over the world. And when I think of ivermectin, it's amazing. I think if you wanted to design a drug that could combat onchocerciasis in some of these communities, you would probably design it as ivermectin. Why? Because it's effective. It just works very well in combating onchocerciasis. It's cheap. It doesn't need refrigerating. It only needs to be taken at one dose once a year to provide prevention or to treat a patient who might have a parasite. So really important role it's had. And of course, these are just the two mainstays that global health strategies or interventions will involve. They will go to endemic areas where the population is known to be at risk or have circulating onchocerciasis. They will treat everyone within, first they will incorporate lots of insecticides, but also importantly, they will treat everyone with ivermectin, as many people as they can. And they'll go back again every 6 months or every year, and they'll treat everyone again. They'll do this for 14 years. And at that point, you should know that in that community, everyone has been treated for onchocerciasis. But as I understand, most countries will do this for 6 to 8 years, so still several years. And by that point, it tends to be effectively eradicated in communities. So that is onchocerciasis. So for the next condition I'll talk about, xerophthalmia is the name of this condition, and it is a subset of vitamin A deficiency. So we'll go into this now. So first of all, define vitamin A. What is it? It's important for retinal pigment formation, and that's why your parents always tell you to eat your carrots, which vitamin A is known to have, and you'll be able to see in the dark. But it's also important for cell maturation, division. It's an antioxidant as well. It's found in carrots, stock, green leafy veg, liver, fish, egg, and dairy as well. In vitamin A deficiency, that in itself is a really important kind of topic and concept in global health, in global health as a whole, not just in ophthalmology. It correlates with poverty, with comorbidity and mortality. Sorry, not morality, mortality. Why? Why is this such a issue in some countries? Some countries just have less access to animal products, less access to supplements, and also the type of populations that will be affected by vitamin A deficiency are also the type of populations that may have, unfortunately, may be associated with lots of chronic diarrhea. And that type of chronic diarrhea means the less absorption of vitamin A. So again, chronic diarrhea is another massive global health issue. So it's all kind of culminating with vitamin A deficiency. But we're looking at xerophthalmia here, the ocular manifestation of vitamin A deficiency that may progress to blindness. Here is a map again of how xerophthalmia is spread throughout the world. You can see in red, those are areas where it's classed as clinical. In orange, severely subclinical, and in yellow, moderately subclinical. You can see the areas where it's clinical are including lots of sub-Saharan African countries, Yemen, some of the South Asian countries, some countries in Southeast Asia as well. So really big spread. And this is the progression, the pathology of xerophthalmia. And it does actually start with night blindness, the thing that your parents were telling you to eat your carrots for. But then it's actually a spectrum of disease, and it does start to get more and more serious. After the night blindness comes a dysfunction of tear film production. Once you've started to affect tear film production, you're going to start seeing effects on the conjunctiva and the cornea, which need that tear film to have normal function. You might get crystallization of the conjunctiva, known as Beto's spots or conjunctival stenosis, which this image is showing here. It's in the equator of the eye. So those are Beto's spots. And after that, you might get an even more severe effects that diffuse drying out of the cornea, corneal chevrosis. And as those of you who will have had ophthalmology placements, or are going to have ophthalmology placements, you'll find out that once you dry the cornea out, you're removing one of its main protective factors. You're going to make it very vulnerable to infection, ulcer, and perforations as well. And that's exactly the case here. At the kind of end stage of xerophthalmia is a corneal ulcer perforation. And that is when the cornea is starting to get affected, and it's really going to affect your vision permanently. How do you prevent xerophthalmia? As many of you may have guessed, it's through vitamin A supplementation. It's as simple as that. It's a major target for global health intervention. Again, it's not just ophthalmology we're talking about here. Vitamin A deficiency has very widespreading consequences and effects. So again, this is looking at the fact that we're reducing blindness with vitamin A supplementation, but we're also reducing mortality as well. And finally, the last disease that we're going to look at is trachoma. What is trachoma? It is a disease that's caused by repeated conjunctival infection by Chlamydia trachomatis serotypes A to C. So these serotypes are not the STI version of Chlamydia trachomatis. That's serotypes D to K. This is A to C that's causing the disease trachoma. It's the most common global cause of infective blindness. Epidemiology, so risk factors for trachoma is poor hand and face hygiene, being close to others who are infected, being close to lots of people who are infected, and being in close proximity to flies as well. In some respects, it's a bit similar to the concepts or the epidemiology factors with oncochiasis, because you get these endemic communities where everyone might be infected, they're spreading it to each other, and of course, again, they're native vector flies. So it is also endemic to 51 countries as well. So again, quite widespread, but not something that you necessarily see in the UK. This map again is showing prevalence of trachoma worldwide. You can see it's mainly affecting sub-Saharan Africa and North Africa as well, and some other countries dotted around the world. So lots of countries it's affected, but again, not maybe the high-income countries or the traditionally high-income countries. So what is the pathology of trachoma? The repeated infection of Chlamydia trachomatis, it will cause scarring of the conjunctiva and changes to the conjunctiva and the eyelid that's as well. On the left, you can see this condition or effects of trachoma, which is called Oncochiasis. It's the interning of the eyelashes. On the right, what I've tried to show is entropion, another change associated with trachoma. It's the interning of the eyelid. What this image shows as well, if you look carefully, is that both the Oncochiasis and both the Oncochiasis combined with the entropion is causing the eyelash to scratch against the cornea. Once you've got those changes, the eyelash is going to continually scratch against the cornea, and that's going to affect, again, it's going to be affecting and damaging the cornea. And once you start to affect and damage the cornea, it's going to affect transparency of the cornea. Once it starts to scar up, and that's going to really affect sight. So yeah, as I mentioned, just again, repeated infection leads to Oncochiasis and entropion, which leads to corneal damage. So we prevent and treat trachoma with this safe strategy. That's how global health interventions, it's what they revolve around. So in terms of treatment, it's surgery or antibiotics. Surgery is the main treatment for any eyelid deformity. In this case, it's entropion. And antibiotics, a single dose of azithromycin can eradicate the infection. But more importantly, in this case, it's still the prevention, because it is so simple, and it's good hand hygiene, good face hygiene, and environmental change, good education within the population to know about how serious this disease is, and that they may unfortunately be carrying it, and to make sure that they are or at risk of it as well. So they may just have to observe that good hand hygiene and face washing. And so in summary, what have we looked at? We've looked at 3 diseases that are easily preventable. They're easily treatable in the early stages. But left untreated, they can progress to serious corneal damage. We've seen with all 3 that when they're not treated, they're not prevented, they progress to corneal damage, corneal opacity. Once you've got to that stage of sight loss, or once you've got to corneal opacity, the only way to treat it, even if you get rid of the infection or you get rid of the parasite, or you give them vitamin A, the only treatment for that loss of opacity in the cornea is a corneal transplant. And that's something that's really, for want of a better word, quite a big surgery. It's quite a high-end surgery, and it's something that ophthalmologists have to train years to really get a hold of. So yeah, you can really see why it's so important to prevent these diseases. And yeah, that last bullet point is just to really reiterate that point. These are 3 easily preventable diseases, and yet they're still some of the leading causes of global blindness and visual impairment. Please look back at part 1 if you want to see other causes of global blindness and visual impairment. So that is that. And then again, just to reiterate, this is what we've looked at. We've looked at some of the preventable diseases that are part of avoidable blindness. So that's why global health interventions look at these diseases to try and combat the disparity in global health, blindness, and avoidable blindness. So that is the end of part 2. We've looked at 3 avoidable causes of global blindness and visual impairment. I will end it. So I'll end the presentation here, and please keep a lookout for part 3. In part 3, we'll be looking at a case study of a global health intervention. So keep your eye out for that on the Medics.Academy YouTube channel. Please like and subscribe this video. Hope you've enjoyed it. I hope it's been good information for you. So have a good day, and see you in the next video.